Hi everyone, this is Bonnie Wheeler, and I am going to present to you my digital reflection on the benefits of hospice. Introduction. In the 1970s, hospice care for the terminally ill emerged in the United States as a way to bridge the gap between diagnosis and death and meeting the unique needs that arise in the end-of-life experience. Prior to this philosophy, support for the dying was not a universalized intervention and was handled separately between the clinical settings and families. Hospice care prioritizes quality of life and offers an at-home environment, palliative care, and support for both patients and families. Today, it is widely offered to patients who have 6 months or less before their anticipated death. With all of its advantages, only 45% of Americans use hospice care, preferring to continue with cure-based treatments. Despite the stigmas and misinformation that circulate about the program, the hospice focus of care has been shown to lead to a better quality of life as death approaches, as it assists with medical and palliative care measures and supports the emotional and spiritual needs of patients and their families. Hospice is the most beneficial treatment for the terminally ill. Relevance of the research. 8 years ago, I was diagnosed with a devastating genetic illness. After several surgical attempts to prevent my disorder from continuing to destroy my health, my doctors determined that there wasn't a way to stop the progression of my illness and suggested I enter into a hospice program. Fortunately, after a year in hospice care, my health improved rather than declining. The experience was profound. I realized through conversations with others that the hospice philosophy of care is not well understood. It is with that understanding that I wanted to explore the topic. Hospice meets medical needs. Although hospice services can be provided in residential facilities and hospitals, in the United States, the majority of hospice occurs in the home setting. Homes can be fitted with hospital beds, IV pumps, oxygen machines, and accessibility equipment. Instead of being forced to spend their final days in the hospital, nurses, doctors, home health aides, respiratory therapists, and physical and occupational therapists will administer the complex medical care a hospice patient may need in the comfort of their own home. Hospice meets mental health needs. Addressing the emotional needs of the dying and their family members is just as important as meeting their physical needs. The grieving process may begin with the diagnosis of a terminal illness, but it is not easily reconciled just because death is imminent. Social workers and other counselors can help the dying speak to their family members about what is happening in their final wishes. In addition to social workers and chaplains, the hospice patient can have other services to help their emotional needs, such as pet therapy, music therapy, and art therapy. Having emotional needs met by a variety of sources can endorse a more peaceful passing. When health professionals in end-of-life care facilitate well-being and quality of life for people and caregivers at the end of life, this promotes a good death. Hospice meets spiritual needs. A key member of the hospice team is the chaplain. Hospice care is a unique setting to address existential questions like, what happens after we die? Spirituality is an important part of human existence. Although not everyone practices religion, many still seek spiritual comfort, especially during times of grief and loss. Often trained in interfaith ministry to provide spiritual support, clergy members who work for hospice services do not require patients to be a part of a particular religious faith, but focus on providing prayer, meditations, and other spiritual supports. The clergy member will also support the families involved. Having the spiritual needs of the patients and family tended to helps all involved work through their grief and find comfort despite the presence of death. Concerns regarding hospice costs. Although hospice is considered the gold standard of care in the U.S. by modern medicine, Misinformation and stigmas about the service continue to spread, preventing those who would benefit from hospice from accessing care. One common belief is that hospice care is too expensive, especially for the elderly who rely on their Medicare benefits to cover their health care needs. Hospice benefits are covered by health insurance. Assumptions that hospice care is too expensive create an unnecessary and avoidable socioeconomic barrier. In the United States, most insurance policies, including Medicare, provide a hospice benefit. In 1982, President Ronald Reagan signed into law the Medicare hospice benefit. So if you have medical insurance, including Medicare, you can rely on access to hospice services at no out-of-pocket cost. For those who still fall through the system's cracks, many nonprofit hospice agencies will accept patients without insurance and provide services as charity or on a sliding scale. Whether a patient is on Medicare, Medicaid, or has private insurance, their plans include hospice benefits. If they do not have insurance, there are programs available to help meet these expenses. Meeting the misinformation head-on. Commonplace myths and misinformation about hospice continue to spread. One way to remediate this confusion is walking through the hospice steps and stages with a patient and their advocates. Social workers and medical providers must explain in clear terms what constitutes hospice care, all of its proven benefits, and how it's paid for. Conclusion. In conclusion, hospice care programs promote the best outcomes and reduce harm for the dying. After a certain point in medical intervention, the priorities of cure-based care begin to critically neglect patients most in need of more support. Cure-based treatments neglect the spiritual and emotional needs, ignores the needs of the extended family, and focuses on relentless treatment that will no longer prevent death but will propagate unnecessary suffering when an alternative relief from better and existing interventions is available. There comes a time in terminal patients' care status where the best quality of life and reduction of suffering is found in the priorities and unique positioning of a palliative care program through hospice providers. While many Americans do not take advantage of this beneficial for many candidates and remains a crucial part of end-of-life planning for many with evidence-based outcomes. Reflections on the benefits of hospice. My research paper, The Benefits of Hospice, has left me with a strong calling to advance the hospice philosophy through creative writing. Grief, loss, and death are a part of our human experience, and it's one that is universal. In the United States, we still struggle to openly talk about such things. Because of our society, many people suffer alone with their grief and their impending deaths. If the hospice philosophy of care was better known, the support and comfort to the dying and their families could help ease pain and suffering. I would like to share this knowledge. Reflections on the course. As an older student with a gap in my education, I was concerned about my readiness for online classes in this technological age. Each week of Cornerstone Seminar, I felt my confidence build as my work strengthened. One part of my personal discovery was realizing that my work ethic, a transferable skill from all of my years as a mother of three and human service worker, was an asset, and it allowed me to submit assignments in a timely manner and participate in group discussions. I truly believe this course should be mandatory for all undergraduate colleges. In addition to developing critical research skills, it can help students of all ages and backgrounds think about what they want from their college experiences and find the motivation to make their academic dreams a reality. Although the course moves swiftly, the information we explored built in a positive and cohesive way. I will carry the knowledge with me as I move forward at Charter Oak. These are some of my sources. I invite you to pause and read if you are interested. Thank you for listening to my presentation, everyone. It has been a pleasure learning with you this semester. Thank you.